Hello, everyone. We are here at the info webinar from EIT Health Education team, and today we will present your future in health innovation. So first of all, we have a couple of housekeeping rules. First of all, if you have any questions, please go to the Q&A tab. The webinar is being recorded and the slides will be also shared after the event by email. After each program presentation, there will be a dedicated Q&A session where we will be addressing your questions directly, and there will be a feedback survey at the end of the webinar. It will be great if you can just take 3 minutes to answer it. So for our agenda and time slots, I am now first doing a small welcome to all of you, and then afterwards we will have the Digital Medical Devices Summer School presentation, later Masters in Health Data Science, and last but not least, Master in Technological Innovation and Health. And we will have 10-minute presentation for each of these programs and 10-minute Q&A session. So without further ado, who are we at EIT Health and what do we do? We are a vast, vibrant community of world-leading health innovators backed by the European Union. We collaborate across borders to connect and enable the brightest minds from business, research, education, and healthcare delivery, creating a more conducive environment in which innovation can flourish. And together we address the biggest health challenges that Europe faces. How do we operate and how do we make healthcare innovation happen? We use we integrate the 3 sides of the knowledge triangle, the business, research, and education, creating a more conducive environment so that life-changing innovation can happen. Using our collective strength and assets, we drive positive societal impact that none of us could achieve alone. And what do we do specifically in the education team? EIT Health Education integrates innovation into healthcare studies and professional development, bridging the gap between research and real-world application. Our programs are always co-created with Europe's top universities and industry leaders, provide students and professionals with the skills to lead in a rapidly evolving sector. And together, we want to transform the healthcare system by fostering a generation of leaders ready to innovate and drive positive change. And if you want to learn more about education and get our newsletter, please stay connected to our programs through this QR code.
Okay, thank you,
Ignacio.
Yeah, thank you very much. Let me see if I can control the slides. 1 minute. Yeah, perfect. Okay, so thank you very much, and thank you everyone for joining today. And I guess that the question that we have for you is whether you are ready to revolutionize healthcare, and if so, we would like to help you on your path by offering our master program, the Master in Technological Innovation in Health. We are one of the veteran programs in EIT Health. This is actually, we are right now on our 9th edition. And we were born as a master with a vision of not only training engineers as such in the the technical skills required for this, but also engineers ready to face, understand the problems, the clinical problems of our society, and be able to envision solutions and also transform them into viable commercial products. And as such, several universities came together to form this master program. Currently, the master program is comprised of the Universidad Politécnica de Madrid, of which I am a representative. And we also have the Técnico Lisboa, Universidad de Barcelona, and the Sorbonne University in Paris. And between us, we formed this master, which was created as a special track available that you can access from one of our local masters that we have at the different universities. So at UPM, we have the Master in Biomedical Engineering. At Lisboa, you have the Master in Biomedical Engineering. In Sorbonne, you have the Master of Engineering for Health. And in Barcelona, you have, well, I think the name may have changed this year. I think this is the old name, but it's a Master in Innovation and Entrepreneurship in Health. So the idea is that you will enroll in those masters, and you will opt to be selected for the MTIH track within those master programs. So the MTIH is structured as it's based on an in-person teaching. So you will be working in your host university, but afterwards also in mobility in one of the other universities. The duration of the program, well, it depends on whether you start your master in Spain or in France and Portugal. In Spain, the masters are typically 1 year long. So if you enroll for the MTIH track, you will actually be doing 1.5 years. You will be doing 90 CTS. If you enroll in France or Portugal, you will be doing 2 years for a total of 120 CTS. There is no additional cost for entering the program. So you will be paying your master credits, and that will be your cost. So that you're paying the national fees that you would pay by enrolling in your university. So in Spain, you would enroll for a total of 90 CTS, in France, Portugal, 120. Also, as I've already mentioned, you will be doing a mobility. The program uses or is covered by Erasmus grants. So if you are admitted to the program, you will have an Erasmus grant to complete your mobility too. So important dates. Right now we have, as I said, you have to enroll in the local master programs, and by the end of your journey, you will get the title that you have completed the local master program, besides the completion of of the MTIH. So we have to enroll in one of these programs. So at Universidad Politécnica de Madrid, for example, the window is now open until the 30th of June. Sorbonne University already closed the window for this year, and Lisboa will open again on the 16th of June. Barcelona, I didn't mention it, will open or it's not written there, will open in autumn. So the master program will run, if you enter now, you will be in the master program from this September up to July 2027. Depending on, again, on when you enter. And what we're looking for is for students with a strong background in biomedical engineering, also other fields of engineering, but you will be also, since your local programs will be focused on biomedical engineering, you will also be acquiring those skills, and which are looking for how to solve and how to really design solutions in the medtech business. And how do we do our teaching? Well, basically, we try and follow an active learning methodologies. You will be working mostly in interdisciplinary groups and multidisciplinary with people from different engineering backgrounds, but also with the clinical professionals, and you'll be trying to listen to them to help understand the problems and define solutions that work for them, define them, and also try to build business plans on how to commercialize them. Of course, we also have technical courses, and depending on the university that you access, you will have a different background of technical courses. But the overall spirit is that you learn to work together in these interdisciplinary teams, and also use this as experience to build your own networks of contacts that can be useful later on your professional careers. So, as I said, your stay with us will be 90 or 120 CTS, or 1.5 or 2 years. So the basic structure of the program is structured in 3 parts. So you'll have some teachings on your home university. If it's in Spain, it will be 1 semester. If it's in France or Portugal, we're talking about 2 semesters. You'll have a mobility semester in which you will be moving. It has to be an international mobility. So if you're in Spain, you'll have to move to France or Portugal. You cannot move from Madrid to Barcelona or vice versa. And then you'll have a last semester oriented towards completing a non-academic internship. So not at the university, so preferably in a company, where you'll have to also complete your master thesis. So what we're offering is obviously the most important part is the training. Okay, so the I&E skills and their application to medical technologies and to the healthcare field in general. But again, you have other perks just by entering this program. You have access to, for example, the EIT Health Innovators community, where you can expand your networks. Again, that you will be able to tap on in the future. You will gain direct access to stakeholders just by working with them in the regular courses. And of course, being this an EIT labeled program, at the end, you will also receive your EIT Health certification of having completed the program. So we work and we build this program with well, different actors, we could say, of the field of application. We work with a lot of industries. It's just a small representative sample, and of course, it expands every year as students get in touch with different companies. But as you can see, we work with industry, we work with the end users in the hospitals, we work with research centers, and these partners are helping us not only to define the materials and to offer the internships and master thesis, but also can help you in the future to gain some job opportunities or future opportunities. So what's the story so far? As I've said before, we are already on our 9th edition. We're already a consolidated program. Over these past years, we've had more than 200 students enrolled, out of which already 150, we have 150 graduates. We are a very attractive program. What I mean by that number is that we get at least 3 times more applications every year than we can admit. The application is, or the number of spots available is dependent on the university. Since this is a track and not a specific master program, spots are limited. So for example, at UPM, there are 10 spots every year. And well, we are glad to say that at least 3 of our former students have developed their own successful startups later on. So, okay, maybe you're asking, hey, how can I enter this program? Well, the first thing that you need to consider is that, as I said before, we're looking for engineers, preferably degrees in biomedical engineering, but again, there's room for other engineering professionals. Okay, so electrical engineers, mechanical engineers, computer science. We always take them into account also as interesting profiles for the program. It's quite required that you show your interest in innovation and entrepreneurship. And in fact, one of the requirements that we will ask you when you enroll is that in your motivation letters, you indicate this interest and maybe even develop a potential idea that you would like to work on. And of course, you have to have a strong knowledge in English, as the program is taught in this language. The admission to the program is based on several criteria. So first of all, we have the suitability of the bachelor's degree. Biomedical engineering gets the most points, but as I said, the other engineering careers are also taken into account. We take into account also your academic achievements. So basically, your degrees during your bachelor studies. We take into account your professional and extracurricular experience. So basically, what kind of activities have you done in the past that are not related with the academic career? And also, again, your general motivation and innovation potential that we try to assess, for example, through your motivation letters. I'm not going to say more. This is some quotes from our former students, but I think that we have here one of our former students to speak further of the program. I hope that he will speak well of the program too. So in a minute, I will be leaving Jorge the panel. For now, I would just like to leave here. Well, these are the responsible people for the different local programs, and then the coordinators on MTIH. You have there the link to the program website. From there, you have the emails that you can access for all the different coordinators. If you're interested in the program, well, you can send me an email, but I suggest that you also contact the local coordinators if you want, for example, to enter from Sorbonne, Lisbon, Barcelona, or from Madrid. And nothing else from my part. Thank you, and I will be afterwards answering any questions you may have. Thank you.
George, the floor is yours.
Yep. Hello, everyone. I'm Jorge. I'm a biomedical engineering, and well, I am going to talk about a bit of my journey in the MITH master of the EIT health community. So, well, when I finished my degree, basically I was looking for an experience that would not only enhance my technical knowledge, but also offers like a broader perspective of the sector and well, open up like new professional opportunities. So I found this master, the Master in Technological Innovation in Health, and for me, I think it's one of the best decisions that I've taken in my life. And well, I am going to explain why. And basically, I am going to go through the different stages that Nacho told you before. So for me, for example, the first stage took place in Madrid, in Universidad Politécnica de Madrid. And well, it was like we had classes and it was very hand-on and innovation-driven approach. And well, there I not only strengthened my knowledge in biomedical, but also learned to think like more in an innovative way. Um, and when also I can collaborate with people from different background because there are like two different paths. The main path that is for biomedical engineer, but also some of other background people were in the master, and we have like common subject. For example, for entrepreneurship, and well, it was really cool that part. And for example, the second part, it was for internship, and I did in a startup company here in Madrid that calls SpotLab, and it was like they use artificial intelligence for detect different tropical diseases such as malaria. And well, it was really cool. It was intense, but incredibly inspiring. And well, for me, for example, the most valuable part was like experiencing firsthand the real changes of an early stage company. So, for example, I saw like the product validation and the investor relationship, and also how is the team management of a small company. And also the last part of the master was like 1 year ago. And for me, it was the best one. And is when you go to an international university. In my case, it was the Sorbonne Université and in Paris, and it was really cool. There, I continue to deepen my knowledge in scientific and technical areas, and well, I have like a experience related with the entrepreneurship. Really cool because it was like a different cultural and European environment, and well, I really recommend that. And well, I think to sum up, this journey basically allowed me to meet amazing people, build meaningful professional and personal skills and relationships, and also become part of a European innovative environment that is basically the AT community, and it was really cool. And well, I think that's all. I don't know if.
Thank you, Jorge, for your nice words about this program. I think it speaks by itself as well. And thank you for being here. We still have a couple of questions from the audience, so maybe Ignacio or even Jorge can answer those. So first of all, we have the Master in Technological Innovation and Entrepreneurship in Health program in the UPM could be compatible with a part or full-time job. Ignacio, you're muted.
Sorry, I would say, I mean, it's complicated since you have to afterwards do your mobility, and your internship will already be your almost full-time job for 1 semester. Maybe during the first semester you could be working at the same time on another place. But I would say that the master, even though the master allows for partial enrollment, I would say it's very much a full-time experience.
Okay.
I don't know if Jorge agrees when he was
Yeah.
working here.
Yeah, I think it's a full-time master.
Okay. And there's a participant that says that they will only finish their bachelor degree in July or October 2025, and they're asking if they can already apply for this academic year, or should they wait for the next year to apply for this master's?
They're finishing in July, right? You said.
In July or October 2025.
Yeah, sure. For example, at UPM, many people that are enrolling now have not yet finished their bachelor studies, and there are even mechanisms. I don't remember the exact number of ECTS that you can have remaining from your bachelor studies that you can have pending to enroll. That I would have to check the specific rules of our university, but it's possible.
I think that Giulio can just email you directly to ask this kind of question
sure.
as well,
If
so
he's
you can
interested,
check
if he's
on.
interested in accessing through our university, then by all means he should contact me. If he wants to access from Lisbon or Paris or Barcelona, it's better that he contact directly with the coordinators there because they know the specifics of their universities.
Yes, actually, he asked several questions about the average number of students in the masters, and also about the four websites that are specific to this program, as they only have access to the general website. But I think that they can go through our webpage.
If I'm not mistaken, the links to the other universities are in the general website.
Exactly.
But if not, again, we can provide them.
Yes. So Giulio, please just contact Ignacio directly and get all your questions answered directly. And then if it's possible to apply with an academic background in project development, so industrial engineering.
If you're in industrial engineering, yeah, you can apply.
And another question would be economics and business students, in this case, even masters already.
So if they have a background in economics but not in engineering?
No, economics or business.
No, currently we are the admission profile requires you to have engineering background studies because we're technical schools and we're teaching technical aspects alongside with the business aspects.
Okay, thank you. And maybe last question we have is how if you could explain a bit how the mobility works and if any grants or scholarship are available. I mean, you mentioned already the Erasmus possibility.
Exactly. As I mentioned, you have Erasmus grants for your mobility, and basically you have to move for one semester. You have to move to one of the partner universities, and it has to always be an international mobility. So after completing your term in your home university, at some point you will have to move. For example, you're in Paris, you can move to Barcelona, to Madrid, or Lisbon. If you're in Barcelona, you have to move to Lisbon or to Sorbonne.
Okay, thank you very much, Ignacio, and I welcome everyone to get the names of the people that are involved in this master and just contact and see how you can enroll. Thank you for all the information.
Thank you.
We will now just move forward. We are almost done. So as I mentioned before, please sign up to our newsletter, and that way you will stay connected to all our programs. We have all these amazing programs in masters and summer schools, but we also have others in EIT Health. And of course, we also invite you all to join the EIT Health Innovators community, which will, as Jorge actually mentioned, will allow you to connect to the big international European community of innovators in the healthcare sector. I thank you all for your attention and for your time, and we see each other in our next